This next talk from Dr. Shakthi Kumar, who I would ask to come on the stage now so you can see a shining face, is all about a particular industry, and that is healthcare. Dr. Kumar, nice to see you. Let me do a brief introduction. You can smile and live up to the bio I'm about to read for you. Dr. Kumar is an innovator, an entrepreneur, global executive who's held several C-level jobs. He's been a founder of multiple companies. Has been involved in startups and established businesses, life sciences, medical, digital technology. He's also served as a faculty member, as most smart people do, right? They do their faculty job as well for students in the healthcare professional studies. And today he is going to talk us through, as you can see very clearly on the stage, a critical issue about how do we use all this intelligent automation technology to avoid the burnout of the human beings that are actually doing these jobs. So I am going to fade away. Dr. Kumar, welcome to the stage, and we will see you. Everyone, put your questions and answers in the questions. Dr. Kumar, I'll give you the answers. Put the questions in the questions section as the talk goes, and then I'll try to cover as many of those as possible. Without further ado, Dr. Kumar.
Thank you, Christopher. It's a pleasure to be here with all of you. Good morning, good afternoon, and good evening, depending on which time zone all of you are in. And Chris, could you please confirm that my presentation, you guys are able to see it? Yeah.
I am able to see it live and in color. Well, not color yet, just live.
Wonderful, wonderful. So we're going to get started here. And over the course of the last day and some of the sessions today, we've discussed about how wonderful RPA and intelligent automation technologies have been helping industries and as well as making our lives much easier and better for everyone. The focus of my session is specifically how do we use RPA and intelligent automation in healthcare. And if here, what we hope to cover in the session is we're going to go through a quick overview of the current state of healthcare, some of the key challenges, as well as what are some of the pain points. We're going to look at some of the current peri-pandemic realities. What are we really looking at in terms of either the challenges to healthcare professionals, as well as technology implications, as well as what does the future really hold for us? And then the most important thing is the opportunities for impact. Where can RPA and intelligent automation really help us in healthcare? And we're going to then go into some of the various forms of RPA and intelligent automation, just as a refresher, so we're all on the same page. And then we will look into how do we really implement RPA and IA in healthcare, specifically to address some of the current challenges. And then we're going to get into some of the conclusions and the takeaways. Okay. The next slide is just the standard disclosures. Whatever you're seeing right now is solely the views of my views and not really of any other entity. This presentation is not really sponsored by anyone, nor have any form of commercial support. And to the extent possible, I've made effort to make sure all of the due references and citations are included into the presentation. Okay, so let's get started. So the healthcare ecosystem, what we are talking about is across the various healthcare ecosystem components. We have hospitals and health systems, we have clinicians, as well as we have different other points of care. We have the emergency room, clinical care, critical care, we have operating rooms, we have various life sciences organizations that are embarking on very, very valuable drug discovery and research and bringing out vaccines out into the market in a very timely fashion. We have genomic companies out there, as well as we have the payers. They are the ones that actually cover health insurances and pay the bills. And then, of course, the wide range of consumer as well as digital devices that's out there that's spawning the era of personalized medicine as well as proactive health. Now, if this is the ecosystem, the entire ecosystem is grappling with one challenge, which is how do you really do more with less? And what I mean by this is I'm going to take you through some of the key dimensions of this particular aspect across this entire healthcare ecosystem. So the first is, healthcare is all about three main components. One is improving treatments, uh, improving outcomes for our patients, and increasing and enhancing access to our patients. So those are the three kind of like major focused areas for healthcare, no matter where we sit in across this larger ecosystem. So the patients are always the first and foremost, and they sit at the center of our care. And so if we really look at hospitals and health systems today, every single, especially in the midst of the pandemic, every single hospital and health system is constrained with resources, the reimbursements for various procedures. There are challenges in reduction in what they actually get paid for certain procedures. And we are seeing a level of staff shortages that we've never seen in the past. On the clinician side, the workloads are getting longer and longer. What used to be 8 to 9 hour work days, we are looking at 12 hours right now, and at minimum, in some cases, there is always less of clinical time. You spend a lot of time, working on paperwork, administrative processes, as well as dealing with the bureaucracy of the larger system itself. And so it's really taking away valuable time from patient care. If you're really examining any emergency rooms or critical care setting, and this is not really one particular region, but pretty much globally and within the United States as well, is the COVID-19 surges have really impacted ER hospitalization, as well as how people are really approaching a lot of the hospital-based care. For instance, the elective procedures are being postponed, which means that you're really not taking care of your health. And rather than proactively and preventative care, when an acute episode happens, you're hospitalized, resulting in much reduced outcomes, as well as increased expenses and so on and so forth. So the ER, the critical care component, is really getting impacted in the midst of the pandemic. If you're really looking at operating rooms and surgical interventions, we are implementing a lot of robotic-assisted surgery in various ORs, but also there is a overwhelming need for increased documentation. For every single procedure, you pretty much have 6 to 7 pages of clinical notes that needs to go along with every single procedure. And the rising costs of every single surgical intervention as well is something that most health systems, patients, payers, they're all grappling with. From a life sciences standpoint, there is, that's the segment where new medicines, new interventions come into picture. There is rising drug discovery costs, as well as companies are really looking at bringing out drugs and interventions that are really personalized for every single patient. And there is the onset of digital therapeutics, where you actually use the digital platform and the digital medium to address certain aspects of care. It could be, for instance, it's being widely used for depression, substance abuse, and so on. And so that's a very, very fascinating area that's really coming out in the area of healthcare. In terms of genomics, so think about this as we all know, we talk about DNA. So genomics is ushering a new era of patient care. We are able to pinpoint specifically what is wrong with a single patient, and then match that with the right kind of drugs, right kind of interventions, and so on. And what's happening is that when we actually sequence a patient, the genetic data, there's volumes and volumes of information and data that needs to get stored, processed. There is back-end work that is supporting genomics-based discovery as well as patient care. So that is a very important and critical aspect as well. And then we have the payers. We talked about payers earlier on. With the rising costs, there is a focus on looking at population-based sort of a health, where we are not really looking at one single individual, but we're managing population sets across a particular region. We are looking at people with certain disease attributes so that they can be more effectively managed from a proactive standpoint rather than reactive care. Also, there are opportunities, in the payer landscape for substance and fraud abuse detection. Yep. Okay. And then lastly, from a consumer and diagnostics perspective, a lot of the digital devices that are out there, it could be an Apple Watch you're wearing or a Fitbit. There's a huge amount of data that's coming out of these devices. And patients as well as physicians will need to use this data to essentially incorporate that into the care regimen as well. So as you can see here, all these different factors need to be taken into account as we proceed with healthcare, looking at healthcare and the opportunities that lie within healthcare. So let's actually go on to the next slide. I just wanted to do a quick check. Is everybody able to see the screen? Chris, are you able to see my presentation at the moment?
Yep, I can see the screen fine. There's a little, it's like almost like your cufflinks are hitting a knife, a microphone though. Is there anything bumping on your side? Maybe not. I'm not sure. The screen's fine.
Okay, wonderful, wonderful. Okay, so we're going to go on to the next panel here. Okay. So with all these various challenges that are occurring, within healthcare, so what are we looking at some of the focal points, and what do we really need to focus on? And there lies in the opportunity for us. So the first thing is, even before the COVID-19 pandemic hit us, the healthcare systems were really grappling with a lot of different challenges. It could be from cost of care or to specifically either telemedicine exhibit and so on. So let's examine some of these key areas and see, what we could do from an RPA and intelligent automation perspective. Okay. So the focal points of impact. If you're really looking at, and I'm using some, some humor here too,
your
but
slides are not advancing. That might be one problem. I don't see it advanced. I'm still on slide. I don't see the number, but it's the healthcare ecosystem.
Oh, okay. Okay. So give me 1 second. I will come back on. Yeah. Thank you.
Okay. You're now off. I mean, you're there, but the slide is not. And you should be able to share it again. Here we go. It's our healthcare systems. We're already going through change.
Wonderful. Okay. So let's look at some of the focal points of impact of healthcare and how we could look at some of these challenges and specifically where RPA and intelligent automation can help us. So I'm using, as I said, I'm using humor just to kind of drive home the point here, but there is a huge amount of disproportionality in per capita healthcare costs versus, the quality of care metrics. For instance, in the United States right now, we spend about over almost $12,000, per capita on healthcare, and they're rising at a staggering rate of about 4 to 6% year over year. Whereas the quality of care, if you're looking at some of the metrics, are not improving as much, and so that is a challenge. And there are different aspects of it. There are the actual health systems, there are the insured populations and the uninsured populations as well. And that's causing a tremendous amount of intrinsic pressure across the health systems. The second one is telehealth. And telehealth is changing how care is being delivered to patients. And especially with the COVID-19 pandemic, digital health, telemedicine has really taken off. And it is widely being used currently across the landscape. It could be at the primary care setting, or it could be platforms that enable connectivity between patients and clinical clinicians. And so there is an over-reliance on technology, but at the same time, it is creating a tremendous amount of supporting documentation, because it's extremely important in patient care and patient delivery that every single visit, every single encounter is properly documented, and then we have to get paid, for every service that's rendered. So the claim reimbursements and everything else. So there's a huge amount of process overhead that we're dealing with from a telemedicine standpoint. Then, of course, the insurance coverage, the healthcare, the payer landscape. There is a wide range of healthcare plans, coverage plans, and it's dizzying area of confusing area of possibilities of what's covered and what's not covered. What it essentially means is that it is creating a lot of, when a claim goes in for processing, for instance, you go into a hospital for a particular procedure, or you go into a doctor for a visit. Based on the type of insurance, the data that needs to get submitted is completely different. If you're part of a value-based care program or population health program, there are different documentation needs versus, if you just have a managed care program, or if you're in a government-sponsored program, every single type of insurance has its own data submission requirements. So data process overhead is a huge thing that the healthcare industry is dealing with. And then, of course, with the advent of electronic medical record system, data entry of patient information as well as registration clinical notes is a huge component of it, right? And we are seeing increasing amount of errors in recording patient data, the data quality issues in electronic medical record system, and so on, which is really adding additional time, resources, complexity in dealing with healthcare, as well as in dealing with patient care. So we kind of looked at 4 focal points of impact that the healthcare industry we're already going through, without COVID-19. Now, if you overlay COVID-19, on top of this, that's layering of an additional set of changes on top of a constrained healthcare ecosystem. And what I mean by this is that with COVID-19, the reality is we are really looking at extended and long schedule, work schedule of healthcare professionals, people working 6 to 7 days in a particular week, especially during surges and hospitalization that's occurring, worldwide. We're also looking at certain types of specialty of medicine, especially emergency medicine, critical care, primary care, pulmonology. There's tremendous amount of staff shortage, meaning that a set of clinicians or nurses, nursing staff are dealing with a huge amount of populations, resulting in stress, as well as data entry challenges, overheads, and a complete amount of backlog of a lot of back-end work that needs to get done. We're also looking at the change. Health systems are struggling with the changes in revenue. For instance, a lot of the pre-pandemic revenue for health systems used to be elective surgeries, people coming into hospitals for taking care of important medical problems. With COVID-19, that has shifted into more of reactive COVID-19 type of care. People are delaying their hospitalization to the extent possible, which means that the revenue mix has changed. What used to be something like a surgical based, surgery based, revenue is now changing to more of emergency care, as well as people are taking a lot of telemedicine, digital medicine. So health systems are looking at their own revenue being reshaped in different ways. And again, all of this leads to process complexities, data overheads, as well as a tremendous amount of back-end work that needs to get done. Also, we talked about the shifting of care, and with the COVID-19 situation, we advanced from proactive care or being, taking care of patients in a more preventative fashion to reactive care, and that is an unfortunate collateral impact of the pandemic. And people are kind of postponing important, health checkups, as well as health, particular interventions that may be beneficial for them in the longer term. And that is something that we are grappling with across the healthcare ecosystem. And the most important thing that the result of all of this is essentially the burnout. With so much that's really going on, everybody in the front lines, from the physicians, from the nursing staff, the clinical staff, including the professionals that are out there supporting patient care, there is a tremendous amount of burnout that's really out there that the industry is facing. And so the burnout issue especially is very acute. And so there are some studies which have been made in terms of what are, especially in the physician segment, you can look at various reports that have come out in the last 3 to 6 months and I'm only sharing a few important statistics, is that anywhere from 60 to 65% of the clinical staff, they have impact in their family life, in their efficiency, they're experiencing stress levels, as well as running out of time. And so what all of this means is that it's actually impacting patient care, it's impacting the efficiency of care that's being delivered, and at times you have to add additional staff to take care of these kind of issues and offset any shortages that result in physicians taking time off and so on. So it's accentuated several of the pain points we've already talked about, right? The shortage of skilled healthcare staff, so there's not enough people to do work. And as a result of that, you focus on patient care. A lot of the back-end work, the paperwork, the data processing, as well as some of the ancillary aspects of patient care is getting pushed out. There is a more and more demand for primary care focus, which is adding to the pressure, and which means that the primary care practitioners, both individual practices as well as hospital systems, are seeing a huge amount of influx of patients, as well as there are bottlenecks in inflow of patients as well. There's reactive care versus proactive care. We talked about that earlier. And then more patients, there's more paperwork, but less available resources to be able to do it. And then there's this huge amount of unpredictability across the entire healthcare system, which means we have to do more with less. And that's exactly where RPA and intelligent automation can help the healthcare industry. So let's now look at, now we kind of discussed some of the inflection points, the pain points within healthcare. We've looked at different dimensions. We've looked at the health systems, clinicians, we looked at payers. So what are those opportunities? How can RPA and intelligent automation help? And the first thing is we have an obligation as well as a commitment to address the peri-pandemic challenges. What I mean by this is that as we are dealing with COVID-19, let's tackle the beast. Let's help the healthcare industry in tackling some of the COVID-19 related, the pandemic related challenges, and we'll talk about what those opportunities are in the following slides. Also, let's actually help out, reduce the burnout of healthcare professionals, which means that they can take more time in addressing patients, in providing clinical work, as well as making their own lives much more efficient and much better for all of us. And then improving health systems efficiency. The health systems efficiency are tremendously burdened now with various extraneous processes, overheads, and so on. So that's an area of opportunity. The fourth one is greater connectivity between caregivers and patients. We talked about telemedicine, we talked about digital medicine, and RPA and intelligent automation. There's tremendous opportunities there to bring the patients and the caregivers closer together in a much more connected fashion. Reducing cost of care. Like any other industry, there are financial pressures on the industry. The less the cost of care, it's good for everybody. Patients pay less, the health systems, they benefit from this, and the payers would love that aspect as well. And not only just addressing the basic conversion of manual work to automated tasks that typically is looked at as part of automation, but I think within healthcare, there's an opportunity to move higher up in the value chain as well. And so we'll discuss a few opportunities we have and what we can do about it. And the last is that there are some longer-term healthcare challenges. For instance, making sure that when we're looking at patients, connecting the patients across the care continuum, all the way from when the patient walks into a clinical care setting to the time they go home and they get better. How do we create an environment that focuses on their overall well-being and their health? And that is essentially the long-term opportunity within healthcare. Is so how do we specifically do that through RPA and intelligent automation? So we'll keep coming back to these 7 areas of opportunities I've listed here. And as we talk about each of these different aspects of healthcare, we're going to map these 7 different opportunities and look at how RPA and IA, intelligent automation, can drive some value to this particular industry. So RPA and IA, so I don't mean to go ahead and kind of like go in detail about what they are over the course of the last day. And today we've talked about what does robotic process automation, intelligent automation mean for the industry. As part of the audience today, we have a lot of companies that manufacture products and solutions. We have services industry being represented here. We have many professionals from healthcare industry that are joined us today. And so in a very nutshell, just to make sure we are all on the same page, intelligent automation is nothing but, through a combination of various technologies and methods and deployment mechanisms, we are helping drive a level of automation in an intelligent fashion. And what we mean by this is that, for instance, RPA, robotic process automation, is a component of intelligent automation. And there are assisted robotic process automation methodologies and unassisted as well, which comes into the broader picture. We have cognitive automation. Cognitive automation meaning embedding some form of a inferential engine. You're learning from both data unstructured as well as structured data to drive some of the automation mechanisms and how it gets deployed to address specific business challenges. So if you look in the right side, the automation encompasses RPA and cognitive, and the artificial intelligence comes into picture, and that's how it starts driving from cognitive onwards to higher maturity models within intelligent automation. The next step in the process, digital assistants, widely used across the industry, from chatbots to speech to text specific applications. They are widely used right now, and that is a value addition as well, and something that we can use specifically within healthcare to drive value. And then, of course, you have autonomous agents. That's a higher level of complexity, so uses artificial intelligence. You're deploying these sophisticated technology components that have the ability, through deep learning, drive a level of automation across the value chain. And for the purposes of this presentation, when I talk about intelligent automation, I'm referencing all these different elements, RPA, cognitive, digital assistants, as well as autonomous. Okay, so if this is the world of RPA and intelligent automation, now let's examine how we can use this platform and technology to address some of the healthcare challenges. So we come back to the same familiar slide, and I'm going to go segment by segment, and we'll look at how we can use RPA and intelligent automation to address each of the challenges. On the right-hand side of the panel here, I'm just keeping this as a reference, the 1 through 7 business opportunities, and so we can cross-reference this so that we establish some form of breadcrumbs, and we know exactly where we are impacting healthcare through RPA and IA. So for hospitals and health systems, RPA and intelligent automation can be used to increase the efficiency of either the COVID-19 testing protocols, the care documentation, compliance, as well as patient registration. There's a number of manual processes that go on within health systems that require a huge amount of people, time, and resources, and RPA and IA can be used very effectively in those care settings. That's number one. Number two, in the health data, EMR stands for electronic medical records. These are the systems that capture patient data. These are the systems that clinicians and others use to document the patient journey. And within health data and EMR data, in that particular spectrum, we can actually, there's a tremendous amount of frustration, because in addition to spending long hours, providing patient care, there is a statistics that there is a report that came out about 20 to 30% of the time of healthcare professionals is actually spent in data entry. So intelligent data capture, voice to text technologies, the ability for RPA and IA to provide some kind of coding checks like ICD-10, error correction, as well as administrative paperwork and so on that can be simplified, will really help enhance the quality of the health data. And subsequently, if the quality of health data improves, you're also impacting interoperability. The third element that we could do within healthcare is more in terms of healthcare operations, supply chain, and this is a very common challenge across various industries. I think as part of the conference in over 3 days, some of the other presentations have addressed this particular challenge, but supply chain connectivity is a huge issue right now within healthcare, and especially logistics, procurement, fulfillment, and so on. And again, there is a huge amount of manual work done that is required for event-driven orchestration across all the way from ordering inventory to fulfillment. And RPA and IA can be a very, very powerful technology to be able to help healthcare in addressing this particular challenge. Now let's talk about clinicians, right? So this is number 4, which is reduce the making sure there's greater connectivity. And these numbers 1, 2, 3, 4 here, we are mapping these opportunities back to the business challenges and how we can address RPA through these various mechanisms. So when we talk about clinicians, we can use RPA and IA to help intelligent staff tiering. When do we allocate, when do we need the physicians on call, or when do we really need the nursing staff scheduled in terms of various days and shifts and so on, so that we can tier the staff scheduling so that the burnout is reduced, as well as a lot of the time where as part of the patient care is spent in lookups, either looking up for the right kind of prescribing information or data authorization and so on and so forth. And so RPA and IA can be used in that particular arena to establish a greater connectivity, but also help reduce the burnout factor of clinicians and the clinical staff and the healthcare professionals. From a payer standpoint, claims processing, huge area of opportunity within healthcare. When a claim gets processed, there was some kind of an analysis done which indicates there's anywhere from 110 to 150 different stage gates that go through when you submit a claim and it gets processed and reviewed. And a lot of this is manual at times, even if it is automated. It is basic automation, so there is no level of connectedness as well. And so within the payer space, reconciliation of claims, payment collection, compliance, as well as detecting certain kind of malicious behavior in terms of fraud and abuse. I think RPA and IA can be used in that area. Now, these 4 aspects kind of addresses the operational need of healthcare. Now we are kind of shifting into the higher value add of how RPA and IA can be used for some of the other areas of opportunities, and these are longer term opportunities. So within operating rooms, so right now there is a proliferation of robotic assisted surgical devices for some of these specific care interventions. So RPA and IA can be used in the operating room setting to automate some of the supporting tasks that the surgeons and the clinical staff need, because there's a lot of support that goes into these kind of clinical settings, as well as as simple as clinical notes, the voice to text kind of transcribing of the surgical procedure itself can save a tremendous amount of time for these healthcare professionals. And of course, there is intelligence augmentation. What I mean by this is that when a patient comes in and we're looking at certain diseases, typically you look into research, you look into emerging kind of evidence-based medicine. RPA and IA can be used to bridge the knowledge gap that exists within the clinical staff, within healthcare professionals, with the most up-to-date repository. And we call this intelligence augmentation. So RPA and IA can help in that particular area. Last but not the least, consumer wellness and diagnostics. So with so much of data coming in, people are using certain devices like Apple Watch and so on to keep their activity levels, that monitor their physical activity, some of the biomarkers, health markers, and so on. And I think when if you look at RPA, this is a tremendous opportunity because you can bring all the information back into the system. It could be data integration, process integration. I think that's a fascinating area that I think will slowly unfold in the years to come. So we kind of looked at the large spectrum. So far we looked at some of the challenges that exist within healthcare. We looked at some of the business opportunities, and in this particular slide we looked at what are those specific ones that we can address through RPA and IA. So for the rest of the presentation, now we'll also look at some of the other dimensions. For instance, how do you really incorporate some of the artificial intelligence and machine learning technologies in healthcare, but as part of RPA and intelligent automation? And I've listed some of them here. And for instance, if you really look at artificial intelligence and natural language processing, they can be applied to reduce coding errors, which is a huge component in healthcare, because everything is based on either diagnosis code, a billing code, a procedural code. So you can actually use AI to go through medical charts, natural language processing translations to look at that and correct these records, which actually impacts the quality of care, believe it or not. Then machine learning, deep learning, you can deploy this because the healthcare industry is also deploying artificial intelligence models. It could be in medical imaging, or it could be even in an operating room setting. The robotic process automation to intelligent automation technologies can connect these AI models together. So RPA and IA can become the bridge between these AI models that exist within health systems. Speech recognition, healthcare worker speech recognition, patient histories. When a patient walks into a room and is going through, the history as well as some of the acute pain points, converting that speech into text is a huge efficiency booster. It's actually even a compliance requirement, and actually helps clinicians in completing the progress notes, for these visits. And then, of course, the autonomous rule-based robotic integration is going to be the next frontier of RPA IA applicability in healthcare. So with all of this, what are some of the considerations we need to keep in mind as we are driving this into RPA and IA into healthcare? What you see on the right-hand side are all the different opportunities we talked about and some additional ones. And so the first specific is that as part of the overall design and rollout, the first and most appropriate thing we got to do is we have to look at which particular RPA and intelligent automation model is applicable for a particular care setting. Does it require basic automation? If it is cognitive, how do we ensure that it operates within a specific guardrail? And so we have to select the right model for the right usage. The process and the data interdependencies are extremely important. We can always implement something that exists on its own in an island, but healthcare, like most industries and probably more, you need greater connectivity of the data for the patient records, the care records, and so on. And so as you roll out these applications, we need to resolve the dependencies and the interdependencies between the different systems as well. The third factor is both the epistemic and normative considerations. What do we mean by this is that how a particular model get rolled out in usage in healthcare is a function of the knowledge of the healthcare worker as well as the contextual setting in which it gets applied. So when we put the design considerations, this needs to be a key factor is, who is applying these RPA and IA models, how is it being used, and what is the greater utility of these models within the healthcare system. Factor 4, once we roll out these models, how do we monitor the performance? How do we know it's working well? Are we really building any kind of closed loop feedback and in terms of especially if you're using autonomous or intelligent automation or cognitive. How are we knowing that the system is actually performing to the design specifications and there is no drift that is associated with the performance metrics? So some considerations to keep in mind. And also another key factor is health equity. Health equity means every single patient, regardless of any kind of race, gender, social status, educational status, has the same access to treatments, has access to the same infrastructure, and the outcomes are uniform across all the population demographics. And so when we implement artificial intelligence, and artificial intelligence is driving RPA and intelligent automation technologies, we have to be very conscious about not introducing any additional bias and skewness, because we all know that as part of healthcare delivery today, there are intrinsic biases and skewness that already exist in the system. Not very, sometimes conscious, sometimes unconscious. These are intrinsic factors. And so we have to be very, very cognizant of the fact that health equity needs to be on the top whenever we look at intelligent automation or artificial intelligence. And there's a number of industry initiatives that are ongoing to address health equity. And I've listed a few of them here. Please take a look at some of the guidelines that are issued. And these guidelines have to be adopted when these technologies are rolled out in the healthcare setting. So the bar for success, we all know there is a rush to get some of these applications out there, but the early bird may get the worm, but the second mouse gets the cheese. So what we mean by this is that if these are the opportunities, right? I just listed them again, 1 through 7. So what is the bar for success when we roll out RPA and IA into healthcare? So let's examine these key elements. So the first bar for success is we have to design these solutions with and for the end users, meaning it could be the healthcare professionals, it could be the supporting staff. We have to design these solutions with them, incorporating their existing workflows, because the patient care is a very highly specialized and it's a very subjective field. And if we are trying to force the adoption of technology with the clinicians, there might be some amount of pushback that you get. So when you include them in the design process, it makes it easier to roll out some of these implementations across. Executive vision and sponsorship. This is true for any major rollouts, but more so with RPA and IA, because there's a lack of awareness, the lack of education at the senior levels. The more senior sponsorship that you get for these initiatives, the better are the results and the impact. Work and productivity. Again, keep in mind that healthcare is all about 3 things: treatments, outcomes, and access, right? And so if you are helping the healthcare professionals to spend more time with the patients versus paperwork and administrative work, I think we are addressing the core problem. And so we need to make sure we make it easier for them to do the jobs. There's a lot of process and data interdependency, especially standardization. There are numerous industry initiatives that's going on within the United States and globally as well for data sharing. So when we roll out these applications, we need to make sure that there is that interdependency is built in terms of standards, process connectivity, and so on. Compliance and regulations, huge component. Patient privacy, patient data, protected health information like HIPAA, these considerations are paramount. So data privacy and some of these security considerations need to be at the top of the design. And so compliance regulations will be something that need to be factored in for RPA and IA in healthcare. And of course, ROI and business case. What are, and the return on investment is both tangible and there are some intangibles as well. Some can be financially measured and monitored. The other one, intangibles, in terms of improved patient outcomes, as well as healthy lives for the patients, better life for the healthcare professionals as well, and reduced cost. So these are the bars for successes, some considerations that keep in mind. And so in conclusion, just looking at my time here, we have a tremendous opportunity here, and I often quote one of my favorites, Stephen Tobolowsky, any endeavor has unintended consequences, and ill-conceived one has more. Meaning that if we don't really pay the right kind of emphasis, I think we may end up doing more harm. And one of the basic tenets of healthcare is start with do no harm. But I think there are huge opportunities for RPA and intelligent automation. I'm very hopeful and excited about all the wonderful things that's going on, and it was a pleasure sharing my perspectives with all of you. And I'll yield the floor back to Chris and for the questions.
Fantastic. Thank you very much, Dr. Kumar. I have some good news and bad news. The bad news is we're running out of time. The good news is I think you're willing to answer questions if people follow up with you. Is that correct?
That's right. Absolutely right.
Okay, so I've got three questions. I'm only going to be able to ask you one right now, but I think if you could make yourself available to answer these questions or the other questions, that would be fantastic. So here is one for you. How do we make healthcare IT support staff and software vendors more attuned to the healthcare environment? IT works great in nuanced environments like loan processing and making stuff, but it seems far less so in the healthcare landscape. So what do you think about this technology and working in the healthcare space?
Yeah, we talked about it. We addressed some of these things, and I think talk to your if you're an IT department within a healthcare system, or if you're a product company and you're rolling out, talk to people in the industry, and this is the right time. And many different avenues where there are tremendous amount of discussions happening on some of the hot topics in the industry, and so they will tell you their pain points. Listen carefully, and the three main ones that especially during COVID-19 is burnout, inefficiency, and the cost of care. And so I think get closer to the business, get closer to the industry, be aware of some of the barriers to entry, and I think it would be a fantastic match between the technology applications and the business need.
It's that real simple thing, the people, right? The real simple part. Right?
Yeah.
Get the people doing everything.
Yeah, exactly. Yeah.
Well, look, that was a very comprehensive look. I haven't seen a view of the ecosystem, the healthcare ecosystem, quite done like that. So that was very useful for me. I want to thank you very much for your time. Your contact details will be available to people on the call and people who listen to this after the fact. So again, thank you for that. And I'm going to do a quick wrap up of today and then a preview of tomorrow, and we'll be done on time. Dr. Kumar.
Thank you very much. Thank you very much, and I look forward to answering the questions posted.
Super. That's great. Take care. Okay, guys, let me, ladies and gentlemen, we say ladies and germs, but that's not a very nice way to say it. Okay, let's do a quick recap of today and then a little bit of what's going on tomorrow. So today we started off the day with Blueprint, the company Blueprint, not only the company Blueprint, but the concept of Blueprint, which is how do you make this transition from one system to the other, the migration from one system to the other. Not only is that a burning issue for some people right now, it's going to be an evolving issue to be able to document what the processes are, to stay current and to stay on top of what we're doing. So that was both Matthew. And again, you can go back and see this. And then we had Mark Chasin take us into the stratosphere, and he talked to us about, because he's an investor, right? He's a CEO of an investing company. To talk to us about all these incredibly environmental issues and sustainability issues and health issues, et cetera, that all are touchy-feely, sound good, except they're also great business opportunities. And that's what he talked to us about. And then, of course, how does intelligent automation relate to that? Well, it enables some of the resources to be freed up to do those innovative ideas. Then we had Jesse Tutt, who took us through, in my view, a great end-to-end, here is a successful deployment approach. Here's how he's doing it. Here's the reason why he's made those decisions. You can go back and watch his presentation, and you can pester him with questions and ask him about the details that you didn't actually all get to. And then we just heard Dr. Shakthi Kumar, who gave us a fantastic overview of the healthcare industry and some of the challenges. I think what is inherent in his presentation is healthcare is also tough. It's tough from a change point. Some of the smartest people in the world, but they're also very worried about screwing stuff up. So they're going to be very careful about that. So let's take us forward to tomorrow. And I will not be your host tomorrow. I will actually be a panelist and involved in the call. And we'll have Jose will be back. If you haven't met Jose, he'll be back tomorrow. He'll do a recap and an introduction for what the session is going to be. And then we're going to cover the practicalities of RPA implementation in a highly complex and regulated market. It's really easy, you know, RPA and something that's simple. That's kind of not that complicated, although don't get me wrong, doing it well still has great ROI. But we're going to talk about the complexities, and Shakthi Kumar is going to do that for us tomorrow. And then, okay, my favorite talk is going to be how to use noble automation to improve your business and stop the great resignation in your company. Okay, I'm being a little shameless here because it's that book, and I'll be giving the talk at 10 a.m. Eastern. And that book is basically an approach to how to do this in a way that engages and excites people in a company and gives them clear directions. Some will leave companies, but gives them clear directions and inspiration. I call it Helping Humans Be Heroes. I would ask all of you, if you could, to attend tomorrow. It would be fantastic. And bring all your friends with you. And I will have a special offer. I'm going to give you guys, whoever shows up, I'm going to send the digital copy of my book. So if you show up, you can save 20 bucks not buying it on Amazon. Anyway, then the rest, we're going to move on to what got you here won't get you there. I love that, right? You know, you've reached your level of confidence, but to get to the next stage, you're going to need to do something different. Tim Bracken, Director of Automation, is going to take us through that from 11 to 11:45. And then we've got one final talk from the Jamaica Public Service Company, and I don't have the title. So I'm not sure what the title is going to be, but I met the Jamaican team, one of the Jamaican teams in Orlando. Fantastic group of people doing great stuff with automation. That is it for the day. I'm going to give you a few minutes back. I don't see any questions that I need to deal with. Thank you all so much for attending. Again, come to Noble Automation now, tomorrow at 10 o'clock, and the rest of the great talks. We will see you then. All the best. Bye-bye.